The Eastern Cape province is battling a hand, foot and mouth disease outbreak. The health department says 13 cases have been confirmed in the province, primarily in the Buffalo City metro. Communications Director in the department, Siyanda Manana, joins us for an update. Siyanda, very good afternoon to you. Thanks very much for joining us. It's a non-fatal viral infection, but I too would be concerned if I present symptoms such as fever, sore throat, fatigue, loss of appetite.
Good afternoon, and good afternoon to all the viewers. Thank you very much for the opportunity, Mr. Mboko. Yes, there is an outbreak that has, we've seen it rearing its head in the Buffalo City metro. Fortunately, it's the only metro where we're able to pick up the outbreak. 13 cases, yes, it's confirmed. We managed to pick those cases up from 4 facilities. Remember, it's four of those facilities, and it affects kids from the ages of 0 to 10. And at this point in time, I think everything is under control. We're able to go out there and educate the facilities in terms of the preventative measures, as well as hygienic, practices that they need to undertake. So at this point in time, that's what we are able to detect. However, what we did also, our outbreak response team, they visited the schools. And we did manage, to pick up about 2 or 3 of them where we were able then to refer them for laboratory testing.
How can or should people protect themselves?
There are numerous ways, in which the population can be able to protect itself. One of those is by making sure, that there's distance maintenance. People are not close to one another. There is also, isolation protocols where suspected and confirmed cases must stay at home. That's what we are preaching when they exhibit those symptoms. And also, the practices, it means that you must make sure that you wash your hands. There's hand hygiene. Ensuring that soap and water are available, and making sure that the restrooms are cleaned, and that when people are coming from the restrooms, they wash their hands. And before meals, people are able to do that. They must wash their hands. Also, at the same time, you must disinfect areas where it's common. For an example, people must be able, to make sure that the door handles, the toys, the desks, and also the shared equipment in schools and preschools, they are properly disinfected. So those are some of the things that we are saying people must be able to do. You must then, close contact between affected and unaffected children and staff, and make sure that there is a distance that you maintain. Health education is something that we're preaching. There's sessions where we've held with, with teachers and parents, as well as with students, about how FMMD spreads so that people are properly educated.
But you still maintain that people shouldn't panic?
No, people should not panic. It's not a disease that causes death. It happens every year. People, in fact, kids, they suffer from it, millions and millions of those. They suffer from those every year. There are no fatalities.
But of course, though they may be rare, complications do sometimes arise.
Well, I cannot rule that one out, that there may be complications, but what we are sure of is that on its own, when you isolate FMD, it does not cause death.
Siyanda Manana, let me thank you very much for your time. Really appreciate it.